following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to a special hour-long presentation of Doctors on Call. Tonight's topic, swine flu. 3 experts are here to answer your questions. Now here's your host, Dr. Kathy Moffitt.
Good evening. West Virginia has been hit hard by H1N1 influenza. Some schools have had to close for a few days, and college students are missing classes, and we've had some deaths associated with the flu. Now some reports are saying that cases have peaked. Are people still getting sick, or are they just staying home and nursing their symptoms on their own? When should you see a doctor or go to the emergency department? Is it too late to get the vaccine? We have an hour to answer these questions and more tonight from our 2 experts. Dr. Kathy Schlemp is a state health officer and director of the Office of Threat Preparedness in the West Virginia Bureau of Public Health. And Dr. Rashida Kaku is an infectious disease specialist at West Virginia University, and she's been leading the flu response at WVU hospitals. We have an hour for this program tonight. If you'd like to ask our guests a question, give us a call. Our phone lines are now open. So Kathy, you know, I'm a pediatric infectious disease specialist, and I've been taking care of kids. Now the kids have been vaccinated in the schools. Is it slowing down? Are we done?
Well, we are seeing declining levels, and that's good news. I think we have to think, we don't know what's going to happen as we go forward. So it's good that we've gone over a peak. We're starting to see the downward trend the last couple of weeks. We'll see what happens and what level of H1N1 continues as we have regular flu season.
Right. And so Rashida, you know, I worry about kids. Everyone's been talking about kids, but what about adults?
Yes, we worry about adults. As you know, adults have been affected. More so young adults, and adults who have underlying diseases, for example, lung diseases including asthma or other underlying diseases like cancers or diabetes, heart disease, etc. So adults are also at risk. Particularly young adults and others who have underlying diseases.
And pregnant women too.
Pregnant women also.
Right. And you know, one thing that's interesting is that we talked about the seniors usually are so used to getting their seasonal flu shot, but they're not in the group yet that we're giving the vaccine to.
You know, seniors are such an important group, and they are so good at getting their seasonal flu shot. You know, I think when we get people good information, they work together to make the right choices in communities, and so it's interesting. The facts are interesting with seniors. H1N1 flu and seasonal flu behave very differently in our seniors. With seasonal flu, they have such a dramatic impact for seniors. Most of our hospitalizations and our deaths are in our seniors with seasonal flu, and that's why the seasonal vaccine is so important. With H1N1, interestingly, our seniors aren't getting it as much. They have some benefits of being older, a little wiser, a little more experienced, and more immunity against the H1N1.
So perhaps maybe they've seen this before? Is that what we think?
Actually, there have been studies looking at their antibody response, which is the protective substances in the blood, and those who are older, at least there was a 25% of them had some what is called cross-protective antibody. Now, this is just in the blood, but the epidemiology or the way the disease has been seen, we have seen that it's not affecting older people as much as it's affecting
Right. So the seniors people. Eventually, when the vaccine's really available, still can get the H1N1 vaccine?
We really want our seniors in time to get the H1N1 vaccine. Right now, we think those that have a higher risk of disease or its complications, we should use our limited supply there. But in time, it's really important for our seniors. And they can play an important role, too, in linking their children with chronic disease, their grandchildren to get vaccinated. And then in terms of their vaccines, make sure they have a seasonal flu vaccine and a pneumonia vaccine.
Right. And so the groups right now who we're targeting vaccination, now it's healthcare workers, so we've gotten ours because we're taking care, we're on the line taking care of patients. Who else right now is kind of the priority of being vaccinated?
There are 5 target groups: healthcare workers that you mentioned, pregnant women, caregivers of children less than 6 months of age, because those infants can't be vaccinated themselves, so you protect those around them, cocoon them there. All persons aged 6 months to 24 years old, because that's who's getting disease most commonly.
Right.
And then our individuals who are 25 to 64 with underlying conditions that put them at risk of complications, because that's actually where we're seeing our deaths most commonly.
Right, in the older adults, but not the elderly, who have, as you mentioned, Rashida, underlying disease. So we have a call from Beverly in Monongalia County. Hi, Beverly. What's your question?
My question is, I have a 23-year-old son that has health conditions, but he's allergic to egg. Is there any way you can help him to prevent him from catching some of the flus?
So is his allergy to eggs severe enough that he's been told not to be vaccinated?
Yes.
Right. Okay. So he can't get either the nasal or the shot.
Right. Both vaccines are made using eggs. The egg allergy that we're talking about when you can't get the shots is a life-threatening egg allergy, so it's severe ones. If you can eat eggs or eat angel food cake or other things that have eggs in them, it's okay. But those people that have life-threatening serious allergies against eggs shouldn't get it. And that is important to think about the other prevention measures.
So like you were saying, cocooning the infant who can't be vaccinated, this is important for him to have all the people around him, if possible, as much as you can control. So his family, if they can get it, his friends, and then hand washing. We know hand washing and hopefully people who are sick staying home to protect people like him who we don't want to get sick.
This really is a disease where a lot of personal responsibility is important, that we're thinking about our own health and safety and also how we spread it to others.
Right. So we have another caller, Betty in Cabell County. Hi, Betty. Go ahead.
Yes. I have psoriatic arthritis, which is an autoimmune disorder, and I was wondering if it's safe for me to have the flu vaccine, or will this make my condition even worse? And I also wanted to know about, just today I heard that some people are dying from the swine flu vaccine. What is going on there?
Okay, good question. So should she get the vaccine having an autoimmune disease?
Yes, you should get the vaccine because, one has to weigh out the risk of influenza in somebody who has immunosuppression, because she told us that that's what's going on. People who are getting immunosuppression may not respond as well, but I think it's still important for her to get the vaccine. But you should only get the one that's a shot. You cannot get the one that's, the intranasal one, because that is a live weakened virus. So the one she should get is the shot.
Right. So it's important. There always is a risk and a benefit of anything that we do. Any medication we do, any vaccine, there is a risk-benefit. And we know there's such disease with influenza that the risks are small with the vaccine, but the safety really is there.
The safety is important for people to know about. And we know that flu can be serious. You can have serious complications from flu.
Right.
This vaccine, both the nasal spray and the injectable vaccine, is made just like seasonal flu vaccine. It's the same formulations, the same manufacturers, the same processes, the same licensure. There's no difference. It's not a new vaccine. So this vaccine is just to a new virus.
Right.
And so I think it's important to think that this is nothing, a different process.
And I think the point we need to make is that every year the seasonal flu vaccine is different strains, is a new viruses that are in that vaccine. This is a new virus we found, but made the same way that it's made every year.
Right. And, every year we have over years hundreds of millions of people have been vaccinated with flu vaccines very safely.
Right. And so let's get back to the safety and especially her question about death in a minute. But we have another caller, Nellie in Raleigh County. Hi, Nellie. Go ahead. What's your question?
My question is it true that the swine flu vaccine contains mercury and should it be given to autistic children?
Okay, so the thimerosal, the mercury, which is a preservative that's in the vaccine.
Right. It is in some of the vaccine. There's also formulations that don't have it. But the key thing to know about thimerosal, it is a mercury derivative. They have done lots of studies looking at, is there any link between thimerosal and any adverse health outcome, including autism.
Right.
And all the studies that they've been looking at, and they've been many, many, many of them, do not show an association there.
Right.
And even as they've taken thimerosal out of other vaccines, our autism rates have not changed.
Right, and it doesn't affect a child who already has autism to receive thimerosal. There's no link with any worsening of disease or anything. No. Now, the vaccine for the really young infants, 6 months to 2 years or 3 years, they're single-dose vials, so they don't have preservative in them. They're only used once for that child. There's no mercury in those.
Right, and also the nasal spray has no mercury. So while medically there's no reason to prefer with thimerosal or without, there's medically no difference, but if a parent prefers one or the other, you can think about either the pre-filled syringes or the nasal spray.
Right. We have another caller, Carolyn in Monongalia County. Hi, Carolyn. What's your question?
I have the swine flu on October 9th. I have been fighting it because I have asthma. I'm scheduled to get a flu shot, the H1N1, next Tuesday. I was just at the doctor today. I was put on another dose of antibiotics, cough syrup, and prednisone. My medical doctor says that if I took the shot on Tuesday with being on the prednisone, he didn't think it would be 100% effective. Should I get the shot, and what do you think about the effectiveness of it?
Can I ask you, so in October, was it confirmed that you had H1, or did they think you had an influenza-like illness?
It wasn't confirmed. They
Okay.
thought it was.
Okay, so she had influenza. Now she's still having effects with her asthma and is on prednisone. What's her response going to be to getting the shot?
Yeah, obviously, if you are on something like prednisone for a period of time, your response may not be as good as somebody who is not on prednisone.
Right.
How much dose is she getting? Do we know? I don't know how much.
Yeah.
How much is she
So
taking,
how high a dose?
So well, if somebody takes 10 milligrams for 30 days, that is an immunosuppressive situation. So she might be taking more. I don't know.
Right, and if
so the response will not be as good as if you're not on prednisone.
That's why it's important that she work with her own physician as to what's the right time to take
yes.
them.
And I think the other point is that if you definitely have confirmed H1N1, then is there a benefit of getting the vaccine?
If this were definitely confirmed, then not, because you will get immune from the virus itself, although I don't know if she was on steroid at the time.
Right.
And interestingly, the vast majority of people have not been tested for definite confirmation.
Right.
And so even if you have had it, if you've had swine flu but aren't sure, getting the vaccine is not dangerous.
Right, because it could be that influenza-like illness was maybe something else, or so we don't know for sure. And there's no harm in getting vaccinated. It will just boost your immunity. So let's go back to the safety of the vaccines. The big thing she said was that there have been deaths linked to vaccination.
Yeah, and actually there have not been deaths linked to this vaccine. So I think there's lots of stories that go around, and I think that's the importance here, that we need to make sure people get good information, go to good, reliable websites, talk to health professionals with expertise in these arenas, to get good information and good facts so they can make good decisions for themselves and their families.
So so there are two vaccines. The one is the inactivated shot, which anyone 6 months and older can get, anyone who's immunosuppressed can get. And then we have the live attenuated vaccine, the weakened strain of the virus as a nose spray. And the ones who get the live spray,
the live spray is really people who are completely healthy between the ages of 5 and 49.
Yeah.
2 and 49.
Yeah, we can actually give it down to 2 years. Yeah, 2, right.
For the older, but now it can be given to early.
Right. So, and the main side effects, the kids may have, or adult may have a little runny nose a day or two after the flu miss, the live attenuated vaccine, or be sore in their arm. And there's a syndrome called Guillain-Barré syndrome, which is associated with flu vaccines.
Well, it's interesting. It was associated with a flu vaccine back in 1976. And in that situation, there was a slight increase in Guillain-Barré syndrome in people that received that particular vaccine.
Right.
And it was, in that time, it was about 1 in 100,000 doses. They thought there was one extra case there. They've looked subsequently at flu vaccines and to see is there an association between Guillain-Barré syndrome and the flu vaccine.
Right.
Some studies have found no association. Other studies have found that if it does occur, it's about 1 in a million. So it would be very, very rare.
And so if you look at the risk, in 1976, that flu really kind of petered out and it really didn't cause disease. So the risk perhaps for the vaccine was more than what the flu was that year. This year it's different because there's a real risk of getting H1N1.
There is. And what's interesting, Guillain-Barré syndrome occurs not uncommonly. There are 6,000 to 9,000 cases of Guillain-Barré around the country every year, unrelated to vaccine.
Right.
In fact, it's often associated with certain infections, Campylobacter infections, or even influenza infections.
Right. And so what it is it's a paralysis that comes from kind of from the feet on up. Right,
Yes.
Rashida? Yeah.
Yes.
And is it if you've had Guillain-Barré, should you be vaccinated?
Probably not.
Because there possibly is that risk of Guillain-Barré. So that's one group, a small number of people. That would be one reason really not to get a flu vaccine.
I really recommend that if you develop Guillain-Barré within about 6 weeks of a vaccine in the past, you should talk to your physician about that.
Right.
To decide what's your risk of complications from flu versus any potential risk that,
Right.
that a vaccine could infer.
But people, I've seen children with Guillain-Barré, and it's usually we don't have a reason why they develop it. They've all recovered. Most adults recover from Guillain-Barré as well,
They
right?
do. And just like Kathy was saying, there's a background of Guillain-Barré, so that occurs without any vaccines or without
Right.
anything. So we don't know all the causes. So it is sometimes easy to connect
Right.
one thing to another.
Right.
I think that's an interesting piece. I think the concept of background rates are important. Because all the time we have people that have heart attacks, that have miscarriages, that develop Guillain-Barré syndrome. And if you are vaccinating enough people, there's going to be some that occur just in time with
Right.
that. And so it's interesting, whenever there's a close association in time, we want to hear about it because we want to look at that more closely.
Right, and make sure it's not
And
really
make
real.
sure. And so
Right.
what we do is we look and see, could there be a link in that situation, or is this a background situation?
Would it have happened anyway? Right.
So there's lots of systems in place for watching for those
Right.
things.
We have a caller, Joyce, from Randolph County. Hi, Joyce. What's your question?
Yes. I would like to know, I've got asthma, and I would like to know if you got asthma, how can you tell if you got the swan flu, like the side effects? How would you know if you got the swan flu? Like, what would you be dizzy or what?
So symptoms
let you
of,
know.
Yeah, that's a good question.
That's a good question. The usual symptoms are fever, respiratory problems, so cold type symptoms, muscle aches, pain behind the eyes. And sometimes in this particular influenza, which we don't usually see with the seasonal, there is about 20% or so people will have some diarrhea and vomiting, which is not usual with the seasonal influenza. So typically those types of fever with cough, respiratory symptoms, muscle aches.
Being achy. And usually it's pretty high fever. And some it lasts a day, some it lasts 3 or 4 or 5 days. It can really vary, but usually the fever's a pretty striking part of the disease.
And it's so interesting, like seasonal flu, there's a real spectrum. Some people probably have such mild disease they never realize they had it. They have a little bit of a cough and never develop a fever. Others have the more classic symptoms that we
Right.
talk about. And then a very few, unfortunately, have more serious disease.
And I've been seeing and hearing more about even some of the WVU students who have very short disease with H1N1. It gets confirmed, but I think they're coming in to be checked because they want to know, and we say, gosh, you only have half a day or a day of fever. It still can occur, but it shows that there's a spectrum with influenza. So we have another caller, Emma from Berkeley County. Hi, Emma, what's your question?
Hi. When I was a teenager, I'm in my late 60s, I had the Asian flu. And I heard on TV a doctor saying that the Asian flu and the swine flu are similar, and then if you had the Asian flu, like I had back in the late 50s, that you may not get this type of flu. And I also have COPD and asthma, and I've never had a flu shot because I'm allergic to eggs. So, but I just wondered about the Asian flu and this swine flu. Is there some connection?
Right. So was that 1957?
1957 was the Asian flu, and there was a totally different virus. So it was H1N1. So that's a different part of the virus, the surface of the virus, which is right now is H1N1. That was H2N2. So no, there would be no complete protection of.
But we do think that there are some other years.
Right.
So her physician may have been talking about the fact that sometime in the past, because she mentioned she's in her late 60s, we know that many of those individuals have been exposed to some virus that was similar. We just don't know when it was.
Right.
So he may have been referring to the fact that she's likely been exposed in the past to a similar virus, and so may have some natural protection and immunity. That's why we're not seeing so much disease in our seniors.
Right. So again, for her, protecting around her since she can't get the flu vaccine. We have a call from Tricia in Monongalia County. Hi, Tricia. What's your question?
Yes. Recently, we had our son. He's 3.5. He was a repeat flyer at the PICU at WVUH. He had the H1N1, Strep A, and pneumonia. Now, he is better. He is with us now, and I've had a lot of people to tell me that he would be more susceptible to developing pneumonia in the future. And I've had mixed people telling me that he could have like a vaccine to help prevent onsets of pneumonia in the future for illnesses. I didn't know if that, with his age, was against him, or if it's something that I should pursue. Where would I go for that? And then also, I've gotten mixed information from the fact that he was swabbed and tested with H1N1, that he would either need to get the second booster for that. I've had the health department to say yes, but then I've also had his doctors to say that since he's already had it, he would not need to do so.
So his H1N1 was confirmed.
Correct.
Yeah. Okay. And let me ask you: is he up to date on all his other shots for being a 3-year-old? Okay.
He had his seasonal flu.
Good.
With his pediatrician prior to even when it was actually being offered through the Monongalia County Schools. We actually had taken him in because of the documentation stating that they would not restrain them. And we did not want him to have the intranasal. We wanted him to have the shot. So we had actually taken him out to the health department on the morning of Halloween.
Okay, so he's had Prevnar, which is the pneumococcal vaccine for children, as an infant, because he's had all his shots. And that strep pneumoniae is one of the bacteria that is a risk with flu of getting bacterial pneumonia. So instead of getting, we don't give usually the pneumonia shot to young children, we give them Prevnar. So now the pneumonia shot is recommended for adults, right?
Yes, that's correct.
And then the other thing for him is, I think this as a pediatrician, that I think in the short term he may be more at risk for respiratory illnesses, sometimes asthma, because of having a viral pneumonia. But then in the long term, he probably is at no more risk than anyone else for getting pneumonia again.
You know, and she brought up a question about a second dose, and I wasn't quite sure with whether she'd had a first dose of H1N1 vaccine or not. It's interesting now, if the child definitely had confirmed H1N1, they probably have a natural immunity and wouldn't necessarily need vaccine. It won't hurt if they got vaccinated, just want to make sure. But if the child is getting vaccinated, they would need 2 doses, because with H1N1 vaccine, any child 9 and under needs 2 doses of vaccine.
Right, because they need that second one to boost, because the first one isn't sufficient. Now, so this gets tricky, because if he's had, so when he was an infant over 6 months, if he got seasonal flu and he got 2 doses in that year or last year, then this year, for the seasonal flu, if he's already had 1, he's done.
It's
if he has only had one and he's never had it before, he needs a second booster to the seasonal. But the H1N1, he doesn't need again.
H1N1, any child 9 and under needs a second dose because no children have had H1N1 vaccine in the past. So you always give 2 doses to any child, whether or not they have had a seasonal vaccine in the past.
But because he's actually had the disease, he doesn't need another one. Okay, we have a caller, Mary Lou from McDowell County. Hi, Mary Lou, what's your question?
I was inoculated once before for H1N1. It was the swine flu then. I think it was 1979, and I'm wondering if that conveyed immunity for life, or should I get a booster?
Okay, that's a good question. So a previous H1N1 vaccine.
Or the swine flu vaccine in 76.
Yeah, there is some cross protection, but I still think that it's not enough to then she should still get the H1N1 vaccine.
Right.
Yeah, it's a different virus.
Right, and because in the seasonal flu, there's actually 3 strains. One of them is an H1N1, but not really related to the current one.
You know, it's confusing with the names because H1N1 is, you're right, we have H1N1 viruses that circulate each season often.
Right.
And that's really why you hear people talk about this one as the 2009 H1N1 or the novel H1N1. The circulating seasonal H1N1 is a human virus.
Right.
And this virus, the novel or 2009 H1N1, has components of both swine and avian and human flu. So it's just a different H1N1 virus.
Right, and so the important thing is that every year the viruses that circulate are a little different. And so even though we got a flu vaccine last year, a seasonal flu, we should still get a seasonal flu this year. It's a little different. We need to maybe boost or also get protection because it's different from the year before. So we have Vivian in Randolph County. Hi, Vivian, what's your question?
I was calling about my daughter. She just went to the doctor last night, and she has that swine flu, and she's been very sick. She's had a stroke, and she has heart failure, and she has diabetes. And I was just wondering, should she get this vaccination since she has the flu?
So did they do the test to prove that's what it was?
Yes, they did. Yes, they did.
And can I ask about how old? Is she over 65?
No, that's...
It's your daughter. I'm sorry.
She's 67. And,
I'm sorry, I misunderstood that.
I think there's an important piece here, though. It all depends on what kind of test and how certain we are that it was H1N1 flu. Because there's lots of different kinds of flu tests. And the rapid test that we do in the office most often is really not at all a reliable test for confirming H1N1 flu. And so I would never rely on a rapid test to say I'd had H1N1 flu, or even some of the other laboratory tests they send off to the lab. That's very specific types of tests that really would be confirmatory for H1N1 flu. So I think the bottom line there is there's lots of viruses out there. There's lots of things that can look like flu.
Right.
And if you haven't gotten, and there are only a few folks that have really had very confirmatory, very specific diagnostic tests, it's best to go ahead and get vaccinated and make sure you're protected.
When she's...
Especially in a child that's got lots of underlying risk factors.
So a couple things I think of for her daughter. Sorry, I was thinking her sister then, and it was her daughter, right, who's young. But I think of making sure if she's got some underlying problems, should she be perhaps on the antiviral? Tamiflu, should she be treated? And then you wait until you get the vaccine until she's well, when her fever's resolved.
You bring up an important point, which is while the vast majority of people that are otherwise healthy and don't have underlying risk factors don't need antivirals when they get uncomplicated flu, if they just have mild to moderate disease, there are some people for whom it's very important. And actually, Dr. Koo could speak to that. But those people that are at increased risk of complications, that's where it's very important to think about Tamiflu, or those that are having serious disease and declining in terms of clinical.
I think all those who are hospitalized and seriously ill, all those who are pregnant, those who have underlying diseases, they could benefit. And the sooner you start the medication, the better off they are.
Really encourage people that have those risk factors to call their doctor at the early signs of fever and chills. So they can find out, do they need to be seen, and do they need to get a prescription for Tamiflu or not.
But then the average person who's healthy doesn't need to be on Tamiflu and doesn't need, maybe should call and find out if it's a child, if they're drinking and they're not dehydrated and they're not having trouble breathing, then just controlling their fever at home and not bringing them in.
We actually have an information sheet on our website at wvflu.org that goes over when to seek care for flu. So hopefully that can give people some guidance, because it's a challenging thing to know how to do.
Right. So we have a caller, Nicole from Kanawha County. Hi, Nicole. What's your question?
Hi. Lately, well, within the last, my kid's in daycare, and they're always kind of like mucusy in daycare daily, and I've been mucusy as well, and it doesn't seem like it's going away. And if I go to get, they're like pushing now in her daycare for her to get the H1N1, and the Department of Health is starting to give it out everywhere. If I go get this and get that for her, there's no way that it could like trigger, it in her or in me to make basically the mucus worse, or you know what I mean? Because I've been on like a Mucinex thing. There hasn't been a fever.
So let me ask you, how old is your daughter?
She's 2.5.
And does she have asthma or anything else, or is she otherwise, other than mucusy stuff, pretty healthy?
She's pretty healthy other than that. Like I said, we do a little bit of echinacea or whatever to boost our immune system. But like I said, it's like the mucus won't go away. You know what I mean?
Right.
Like always there.
So who can get the vaccine? When do we decide we shouldn't give it or we should wait to give it?
I think, as Kathy mentioned, the people on whom the vaccine is indicated, those groups. But in terms of giving it, when somebody already has fevers at the moment, it's good to just wait until at least the fever is down, so that you don't confuse some reactions.
But a cold and congestion would be a reason not to wait. So you go ahead, it wouldn't make it worse.
You go ahead.
So if they have fever or they're seriously ill, that's different. But if they're just, from what she described, there's no contraindication.
The other thing, she brought up a good question too. I think she said, could the vaccine at all give my child or make this worse or give her flu? No. Neither vaccine, the nasal spray nor the injectable, can cause the flu.
Right. And you said earlier how there are those temporal relationships, so meaning that something else is happening when we get vaccinated, and is it just coincidence? So I think this is a good one. People say, well, I got the flu. Well, maybe you were coming down with the flu and you got vaccinated, so they don't want to get a flu vaccine this year because they say I got a flu last year from the vaccine.
Which
wasn't
happen.
From the vaccine.
It wasn't. And the protection takes 10 to 14 days to occur there. So you might have been exposed to something a day or two before, and you don't have the protective effect yet with that.
And the other thing is, during that time, there's so many other viruses that circulate around, so you get a cold or a cough, and it may not be the flu.
Right, and what she said is, I know when my son was in daycare, they have almost always have a runny nose, and you see it getting better, and then another one, and those are all the common cold viruses that circulate, and then you throw in influenza in there occasionally as well.
Kathy, we get a lot of questions about the nasal spray. It's a live vaccine, and does that mean it's at higher risk? And it's really interesting. Live vaccines are nothing new. If your child's gotten a measles, mumps, rubella vaccine, MMR vaccine, chickenpox vaccine, seasonal flu nasal spray vaccine, they're all live virus vaccines. They work really well because of that, because of the fact that they're live, but they're weakened viruses. They change the virus so it can't actually cause the disease. So with the flu vaccine, the nasal spray, the virus can't grow past your nose. It's temperatures.
It's actually also cold adapted, which is fascinating. The virus grows better at a lower temperature where your nose is cold and not at your body temperature 98.6.
Exactly. So if it actually gets into your bloodstream or your lungs, it doesn't cause disease. Or if you were, for instance, to cough or sneeze and pass it to someone, maybe you had a family member with diabetes or on chemotherapy, they don't get it either. You can't give it to somebody else. So for instance, in my family, we have a family member who has diabetes. My son got the nasal spray vaccine. That was fine.
Right.
It's a good, safe vaccine for him, and it wasn't going to be a risk for the family member.
And I think it's really acceptable in my population for the little kids. You probably adults are used to getting shots, but my population, they'd rather, I think the kids in Mon County, it was really acceptable getting the flu mist. So we have a caller, Harry, in Marion County. Hi, Harry, what's your question?
Yes, ma'am. I was just wondering if anybody had heard a rumor as to when any of the VA hospitals are going to get any vaccine.
When are the hospitals going to get the vaccine?
Well,
the VA hospital, yeah.
Yeah, they have been getting some vaccine through a federal program for their workforce, and then they'll be working with their health departments, like other hospitals, for getting additional vaccine. We all wish we had more vaccine than we have right now, and fortunately, it's increasing gradually, and I think over the next several weeks, we'll start to see it in more and more locations. But it's just been a matter of supply. But in time, it will increase.
Right, and we expect more seasonal flu vaccine too, is that right?
A little bit. It's interesting. On an average year, they give about 98, 100 million doses of seasonal flu vaccine. And this year, they actually made 114 million doses. And there were some delays in delivery, so there's a little bit, maybe about 15, 20% still coming out. But what happened is when it came out, there was so much awareness about flu that people took their flu shot, which is great. I wish they would do that every year. Right. We'd prevent flu. So we actually have more people vaccinated this year against seasonal flu than ever before. It's just with such awareness, the demand and the supply has been a challenge.
Right. So we have a caller, Rosemary in Wetzel County. Hi, Rosemary. Go ahead.
Yes, ma'am. I'd like to ask about, I am 62 and I have diabetes. I also have heart problems and I only have partial of a lung. And I'd like to know if I should get this shot or if I should go to my doctor to find out or what.
Yes, I think you should get both shots. You should get the seasonal and the H1N1, both of them injectable.
Right. Right, so she's one who may be at a little higher risk having some underlying problems. So
she's in that target population of 25 to 64 with underlying diseases that would put them at risk. And that's actually, while they don't get the disease as often as our under 25, those are the age groups that are most at risk of actual death from H1N1. It's rare, it's still rare, but that's where we see our highest death rates. And so it's an important group to get vaccinated.
Right. So we have another caller, Deborah, in Morgan County. Go ahead, Deborah.
Yes, hi. I was just wondering, I have chronic bronchitis, and I just had surgery. I'm 49 years old, and I was just wondering if I should get the H1N1 flu shot.
So again...
Yes, any underlying disease?
She said bronchitis.
Bronchitis,
yes. Chronic bronchitis.
Yes, you should.
Yeah, so she's in that 25 to 64
with disease with complications, right?
So she definitely should get the both seasonal and H1N1.
The other thing to remember, we talked about the pneumonia vaccines, and pneumonia vaccines that the children get them, the Prevnar that you talked about earlier. We also there is the vaccine, the Pneumovax for adults, and it's indicated for anyone over 65, but also people under 65 with various risk factors, including certain lung conditions and those things, or smokers. And so we think it's important that we make sure that all those people that normally would be vaccinated with that pneumonia vaccine get that vaccine. Because we know that pneumococcus can be a complicating factor of influenza.
Right, so that's a bacteria that causes pneumonia after you've had the flu.
Yes.
So Rashida, can you comment on the really ill adults that have been in the hospital? What are they coming with? Is it all pneumonia?
Yes, they can come in with difficulty with breathing and pneumonia, and then they can require even being on a ventilator in the ICU, so it can be quite a serious issue. I think it shows the importance of preventing it.
There's been some things in the news about obesity. Is that a risk? Do we understand about obesity and the risk for adults?
Well, it appears that way. I mean, there was some study from Michigan, and subsequently other data have shown that that obesity seems to be a risk now, whether it's just by itself or some other diseases, other things that come along. But if they have it, it appears that they seem to have a serious course or severe course.
Yeah, well, we don't really understand why yet. I mean, those are some of the things that we have to work out. Why is that? Or is it that it's obesity with other things underlying?
Or by itself, it appears that once they have it, whether the risk is because of obesity and some other things that go along, but once they have it, it appears that it's a more severe course.
Yeah, and more severe, but we have to kind of work that out. There's a lot we have to learn. Right. What we've been seeing with the kids is that asthma, some obesity, underlying problems with their immune system, and cerebral palsy or neurologic problems. And that's very clear. That's a real problem in children.
That is. We've seen that as a risk factor with a lot of hospitalizations across the country, and in some of the pediatric deaths, there's been an association both with asthma and it was the most common one since asthma is so common, but then the neurologic ones have been another
and
area.
That's concerning. So we have a caller, Deborah, in Monongalia County. Hi, Deborah. What's your question?
Hi. Do we need to get that swine flu shot every year?
So that's a very good question. What about next year? What are they going to do about swine flu?
Great question. You know, flu is unpredictable, and we don't know what will be happening with this virus. There's certainly a very good chance it's not going to disappear. And so it may well be around next year. If they are looking ahead, each year around February, they make the decisions of what goes into next year's flu shot. And so if they're looking at this and they're thinking that it may be circulating next flu season, there's every chance they'll just incorporate the H1N1 virus, the new H1N1 virus we see this year, into next year's flu shot, because they do new flu shots every year with changing viruses for seasonal flu, and this would just be one more virus to put into that shot.
Right, and so the seasonal flu vaccine is more than one virus.
Yes, it's got 3 viruses. It's got 2 types of A, an H1N1 and H3N2, and a B. And so, you know, and then because the other manufacturing had already started before we learned about the swine flu in April, they had to do it as a separate shot.
Right.
But like Kathy said, chances are high that they will, you know, we don't know which way, but most likely they will incorporate it.
Right, so next year there may only be one shot, but we'll be saying, please still get it.
And actually, if this virus had shown up, say, in January or February of this year rather than April or May, it probably would have simply been incorporated into this year's flu vaccine.
Right.
Now, in the past, whenever there is a pandemic virus, sometimes it replaces the pre-existing viruses. But in '77, when we had the Russian flu, H1N1, it did not replace, it started co-circulating. So it will be very interesting to see what is likely to happen. We don't know which way it will go.
We haven't seen seasonal flu. Usually it peaks, February is often the peak month, and we've seen very little. What I've seen on the CDC website is that very little seasonal flu.
And we can say the same thing with our West Virginia surveillance data. Right now, all flu A in communities is H1N1 flu. We have very, very occasional Bs, just been a handful of identified Bs, but really nothing of significance. It's all out there as A.
Right, so it'll be in, we're kind of waiting. I know you are, Rashida, too, of what will we do in January, February, then trying to figure out, but I think that's where the state is helpful to help us say, this is what we're isolating, this is what we're seeing. And is it going to just push seasonal, is H1N1 going to push seasonal out of the way, or are they going to circulate together?
When we look at what happened in the southern hemisphere, you know, of course, they just had their flu season. They're ending their flu season now as we're beginning. Many countries saw H1N1 as the predominant virus through their flu season. A few countries saw the seasonal viruses predominate. So it'll be interesting to see and watch what happens here.
So we worry about perhaps this pandemic, this new flu, maybe mutating. What does that really mean by mutating?
Well, as you know, flu viruses like to mutate. That means they change. So as the population becomes immune, the virus has to change somehow to survive
right.
and infect more people. So that is a very common problem in the flu virus. And the inside of the virus has got 8 different segments, and then it mixes up, like Kathy was saying, this current one, H1N1, has got the human, the bird, and the swine all in one. So we don't know whether even in the spring there might be some change. Sometimes that happens.
Sometimes they change a little bit. It's kind of trivial, and sometimes they do a big change, and then we're susceptible. But they're trying to survive and keep going.
One of the good things that we do know is that currently, since that we saw this virus emerge in April, there's been no change.
Right.
It's been very stable at this point. The other good news with that is that means it matches the vaccine very well.
Right.
So what's circulating now matches the vaccine. But we always want to watch for that change, because that's where we can have more complications or problems sometimes.
Right. We do have another caller, Sherry in Harrison County. Hi, Sherry. Go ahead.
Hi.
Hi.
I was calling because I have got the seasonal flu vaccine, and I've also had the pneumonia vaccination I believe it was about 6 years ago. I have underlying conditions. I have sarcoidosis, which has been in remission since '93, and also they said I have asthma, but I am not being medicated for that at this time. I'm going to get the H1N1 vaccination, but my question is, do I also need to get revaccinated with pneumonia vaccine, or am I still covered for that?
And can I ask approximately how old you are? You can say a decade.
I'm 42.
Okay. So she's got sarcoidosis that's been in remission. She's had a pneumonia, the Pneumovax, 6 years ago.
Yes, people who are, she might have been on steroids previously, I don't know. So people who have had their spleens out or they are somewhat compromised, you can get another shot in 6 years.
And is it five, do we say 5 years to get another one? So it might not be a bad idea for her to get another one.
You usually never need more than 2 pneumonia shots. It's not like flu vaccines every year. You either, if you're over 65 and get your first one over 65, or don't have some of those very high-risk conditions, then one's enough in your lifetime. But there are some people that should have 2, but you really never need more than 2 typically in a lifetime.
Right. So we have a caller, Mary from Monroe County, Ohio. Hi, Mary. Go ahead.
Hi. My daughter is a breastfeeding mother. She has a 7-week-old baby, and she also has a 2-year-old that was on prednisone because of a skin condition, maybe 3 or 4 weeks ago. But anyway, she got rid of her cold, or most of her cold, the congestion, but she has a terrible sore throat. Saturday, first off, will the immunity that she gets from the shot be passed on to the baby? Really sufficiently, and also will this help the little girl if she she gets a shot also?
So let me ask you.
Not a virus, not the nasal.
Yeah. So the 2-year-old is off of steroids now?
Oh yes.
Good.
She was only on it for maybe a week.
Okay. And your daughter got her H1N1 while she was pregnant?
No,
since?
No, she never had it.
Oh, she never had it.
She's now going to get it started.
Yeah, she needs it. All right. So these are good questions. The little baby will not get protection from, it gets great protection from breastfeeding, but really not protection against flu, other than that the mother and everyone in the family get vaccinated.
Right, well that's going to be really important that everybody around that baby get vaccinated so that they can protect that baby, because you can't vaccinate either with seasonal or H1 vaccine until a child is 6 months old.
Right.
Breastfeeding is a wonderful protective effect in general for babies. It will be important when the mother's vaccinated. There's potential that a little bit of protection may pass through that breast milk. It's not the primary arena there, but I think the breast milk in and of itself does so much to boost a child's immune system and to be healthy with that child that's just the act itself is going to be a good thing.
So again, what we had talked about before, Rashida, is that if her daughter is not febrile and just has some congestion or cold, she can be vaccinated and then in 2 weeks should be protected so she won't get flu and then protect protect the baby.
And actually, assuming that the breastfeeding mother is eligible for either the nasal spray or the injectable, either one is fine.
Right. It's not a risk to the 7-week-old baby for the people around them to get flu mist if they're eligible.
Absolutely.
Right. Either one. So we have a caller, Kelvin, in Kanawha County. Hi, Kelvin. Go ahead.
Yes, I have a question that I'm 55 years old and I have MS, and I've been on a Rebiffa drug and a Copactin drug, and my immune system goes up and down. So should a person have the virus shot that y'all are speaking about, or what?
Right. So he's got MS. He's 52.
55.
55, excuse me. Well, you sound younger, so.
Absolutely.
Yeah, he should absolutely be vaccinated. He should get the shot.
Take the shot.
Right.
And again, that's a target group of, you've got those adults, 25 to 64, that have underlying conditions, and you would want the shot, not the nasal spray.
Right.
Because the nasal spray is for 2 to 49 who are otherwise healthy, and the shot is for anyone 6 months and up.
Right. Right. So really important. How late is it too late to get vaccinated? Is it too late to be? We've talked about vaccination. We've saying get vaccinated now. Is there a date when we're going to say don't be vaccinated?
You know, this virus has not gone away. Just because we're over a beginning of that curve and that peak, it's still fairly widespread in our communities. Right. As we talked about, we don't know what's going to happen over flu season. Will this virus predominate and be the one that's circulating? Will seasonal flu viruses predominate? And in addition, we don't know if there'll be another peak that occurs in the spring.
Right.
So I think we have a good opportunity to reduce risk. And to use the vaccine.
So as long as we have the vaccine available if you haven't been vaccinated. Now, what about, how long does, I've heard people say if you get vaccinated too early, like in August or September, it won't last through seasonal flu, which sometimes can go to May. Is that true or not, Rashida?
Well, I would say that probably the immune response might last for about 6 months or so. We would like Kathy was saying, it takes you about 2 to 3 weeks to develop a response. And so you don't want to, for the seasonal one, we tell them not to do it too early because sometimes there is another peak in late spring and you just want the most protection. Now for this one, we do not really have the data. So, we need it right now. So that's what we should do at the moment. And hopefully things will be all right.
And then stay tuned, and we'll have.
Actually, as more people get vaccinated, hopefully, the little
spread
decrease we have will continue.
Right.
We hope.
And that's been the push for vaccinating school children, because since we know that the vast majority of disease is at 25 and under, and we know that it's easy to spread diseases through children and interactions there. The thought is if we can vaccinate large numbers of children, we'll have less spread in the communities and it'll help protect all of us.
And that's not just H1N1, but that's influenza. And actually last year, the Advisory Committee for Immunization Practices from the CDC recommended that all children 6 months to 18 every year get a flu shot.
And Kathy, I think you bring up a really important point. One of the things that I think this experience helps people hear and understand, flu can be a serious disease and it's a preventable disease, and it happens every year. And so I think this has raised awareness about flu. We know it's the most common vaccine-preventable disease that we have in this country.
Yeah. See, what I'd love to see is that every year our schools do flu vaccine clinics to the seasonal flu. So we have one more caller, Brian in Randolph County. Hi, Brian. Go ahead.
My question is, 8 days ago, I had the nasal vaccine, and then I started getting flu-like symptoms yesterday and started taking Tamiflu. I took 1 dose last night and 1 dose today. My question is if I would quit taking the Tamiflu right now, would my vaccine still have immunity? And would you suggest quit taking the Tamiflu or just keep taking it? Or?
And have you had fever and pretty classic flu-like symptoms the last 2 days?
I had flu-like symptoms, but they weren't very severe. The fever was under 100. I had cough, sore throat, runny nose.
So the effectiveness of the vaccine, this is a good question. What happens, he's had it 8 days ago, his Tamiflu is now the last 2 days. Did he have enough time to respond to the vaccine?
No, he did not have enough time to respond to the vaccine.
And interestingly, the Tamiflu can interact with the nasal spray vaccine.
To make it not
right.
work. Right.
So probably once he's off the Tamiflu, he would need to get revaccinated. Again, with either the nasal spray or the shot, either one if he's eligible for either.
Right.
But interestingly, the Tamiflu can't interact with the shot,
right?
But it can interfere with the effectiveness of the nasal spray.
So it's doing its job as an antiviral.
Exactly.
And, right.
Up to 2 weeks after you start it, and for 2 days before. So
yeah.
You know.
So we have about a minute to go. Any further thoughts? Anything that we should say again, maybe, or you know, it's important to be vaccinated. We've said that.
Absolutely, and I think this is a situation where we can all make a difference, and we all have a role to play.
Right.
There's the actions that we can take behavior-wise in terms of washing our hands and covering our coughs and staying home when we're sick.
Right.
Getting people linked to good information so they can make good decisions, I think is so important.
Anything surprising, Rashida, you think about this flu?
About this flu? No, I think it's sort of slightly different than the seasonal because of the the age group and the time of the year. It came earlier and so on and so forth. So that was a little bit
right, and that we're all susceptible. Right. We've been talking about H1N1 swine flu with Dr. Kathy Schlemp and Dr. Rashida Kaku. Thank you both for being with us. If you'd like more information, see your family doctor or visit the state's website at wvflu.org or cdc.gov. For Doctors on Call, I'm Dr. Kathy Moffat. Good night and good health.
Join us again next week for an encore presentation of Doctors on Call. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.